Welcome back to HPHA's Pre-Admission Patient Education for Hip Replacement Surgery, Module 4, After Surgery and Beyond. In this section, you will learn about everyday activity guidelines, physiotherapy after hospital, transportation, wound care, complications, other activities, returning to work, long-term care of your hip, and resources. Don't forget, you can follow along on the pages 26 to 40 of your booklet. Doing the exercise assigned by your physiotherapist will help you move your new joint and enjoy greater independence. At home, continue the 6 exercises you were doing in the hospital 3 times a day. Don't forget, you can find those exercises on page 24 of your booklet. The hospital physiotherapist will confirm that you have arranged your physiotherapy appointment for when you get home. Your community physiotherapist will teach you exercises to stretch and strengthen your legs and improve your walking and balance. As you recover, these exercises will change. Talk to your community physiotherapist if you have any questions about your exercises or concerns about your progress. Driving is not allowed after hip surgery for the first 6 weeks, regardless of which hip was operated on. After hip surgery, it can be challenging getting into and out of the vehicles. Talk to your therapy staff if you have any questions about traveling in a vehicle. Here's a quick video on how to get into and out of vehicles. You can also follow the instructions on page 32 of your booklet.
Alright, so we're going to talk about how to get in and out of a car. If you're getting into a low car, you're going to want to make sure that the car is parked away from the curb if there's not a sloped entryway. If you're getting into a higher vehicle like a van or an SUV, you can park up right beside the curb because then that helps just get up into a higher vehicle. If you're getting into a low vehicle and the back of the seat is lower than the front of the seat, you might want to consider a wedge cushion just to help maintain the hip flexion angle. You're also going to want to make sure that the car seat is in the rearmost position and then the back angle of the seat is reclined as much as possible. From here, you can take the walker with you until you feel it behind your legs. Move the walker out of the way. You can grab a hold of the door with the window down, reach back for the seat, outstretch your operated leg, and slowly lower yourself into the vehicle. Recline your chest as much as you can. As you're turning into the vehicle, try and keep that outstretched leg as straight as possible and turn yourself into the car like that. To get out of the vehicle, it's the same in the reverse order. So turn yourself out, keep that leg as straight as possible, and recline your upper body. Bring yourself to the edge of the seat, outstretch that affected leg, and then you can push yourself up into standing, pushing up.
At the site of your surgery, you will have an incision or a cut. The edges of your skin are held together with staples, which are metal clips. Your nurse will teach you how to care for your incision and dressing at home. This dressing will stay in place for 7 days. If your incision is draining, or if your dressing is wet or loose, you may have to change it before then. Remember to wash your hands before and after you care for your incision. You may not shower until the staples are removed from your incision. Do not soak your hip in water. No baths, no whirlpools for 6 weeks. Do not apply any creams, ointments, or lotions to your incision. You'll find more information on page 33 of your booklet. Now we'll show you how to change your hip dressing once you're home. Before you change your dressing or bandage, gather and prepare the supplies you purchased before your surgery. Open the bottle of normal saline. This is to cleanse your incision. Open 2 individual packages of 4x4 gauze. This is to cleanse your incision. Open 1 strip of dressing, and this will cover your incision. Follow these step-by-step instructions to change your dressing. Number 1. Go to a comfortable, clean area. Wash your hands and have your supplies ready. Gently remove your old dressing. Number 2. Wash your hands. Open 2 packages of gauze. Each package contains 2 gauze squares. Wet the gauze by pouring normal saline onto the gauze pads. Number 3. Only touch the outside of the gauze piece. Take 1 piece of gauze and gently wipe the incision from top to bottom in one motion, starting in the center of the incision. Throw the used gauze pad away. Number 4, using a new moistened gauze pad, repeat cleaning using a gentle downward stroke down the right side of the incision. Throw the used gauze pad away. Number 5, using a new moistened gauze pad, repeat cleaning using a gentle downward stroke down the left side of the incision. Throw the used gauze pad away. Number 6, let your incision dry completely. Remove the new dressing from the package, pull off the paper tabs, taking care to not touch the side that will be against your incision, and apply it to cover your incision. Wash your hands. The incision should stay covered with the dressing until you see your family doctor to have the staples removed. With every dressing change, please check your incision for signs of infection. Your incision may be infected if the area around your incision is becoming warm and reddened, there is green, yellow, or foul-smelling pus coming from the wound site, there is increased pain or swelling of incision site and surrounding area, or you have a fever above 38 degrees Celsius or 101 degrees Fahrenheit. Call your surgeon right away if you think you have a possible wound infection. Staples are to be removed 10 to 14 days from the date of your surgery. Plan to make a follow-up appointment with your family doctor who will remove your staples. Write your appointment down in your booklet. Despite the success of total joint replacement, there is a small risk of developing complications. Remember, getting out of bed and walking as soon as you are able will help prevent many of these complications and allow for a smooth recovery. You will find more information on possible complications following hip replacement surgery and how to prevent them on pages 34 to 36 of your booklet. If you develop any of the complications listed in your booklet, call your surgeon's office and tell them what you're experiencing. If you are unable to contact your surgeon, go to the nearest emergency department. Call 911 immediately if you have shortness of breath, sudden chest pain, coughing up blood, or your surgical leg is suddenly extremely painful, shortened, and/or the hip cannot be moved. You'll find more information on page 37 of your booklet. You'll learn about air travel, grooming, sexual activity after hip replacement. When you return to work depends mainly on what type of duties you must perform. Most patients do not return to work until at least 6 to 8 weeks after their hip has been replaced. Talk to your surgeon before planning on returning to work. Remind your dentist that you have had joint replacement surgery before having any dental work done. Some activities such as running and contact sports are not recommended after you've had a hip replacement. If you have any questions or concerns, please speak to your surgeon.
Module 4 Summary. Once you are discharged from the hospital, there are many things you will need to do while you recover. Perform your exercises as directed by your physiotherapist. Remember there are no specific movement restrictions following your surgery. Keep your pain or discomfort under control. Take care of your incision and dressing. Watch for and try to prevent potential complications and call your surgeon's office if you think that something may be wrong. Keep all of your follow-up appointments with physiotherapy and your surgeon.
The information booklet that you have been given has much more information than has been presented today. Please take time to read through the booklet and remember to bring it with you to the hospital. If you have any questions, write them in the booklet so you remember to ask them during your hospital stay. We hope you found the information in this module and booklet useful. We wish you a speedy recovery and many happy active years with your new joint.